Okay. So that is just a really quick description, and I'll get into some of those things that were on that video. But I know we're all really excited at Aesthetics Biomedical that Dr. Lane has brought in the Vivace RF microneedling device. It is truly the best combination in the market today. Um, we combine radio frequency and microneedling with a series of 3 treatments. You get unbelievable results with little to no downtime. So I'm going to get into all of that right here. So I'm going to first start with the history of facial rejuvenation. So I'm sure a lot of you have heard of the old school CO2s. They kind of came about in the 90s, and it was fully ablative fractionated laser. And while the results were really high, the risk was pretty intense. You had a risk of loss of melanin. I don't know if you've seen some of those women where maybe they treated their face and their neck is a different color. They often maybe have had an ablative CO2. So the risk was really high, and but the results were really high as well. Downtime up to 2 weeks, 3 for some. A lot of plastic surgeons would do this when the patient was under after having a facelift or something like that. So then in about 2005, we moved on to a fractionated ablative CO2. And that was exactly what it sounds like. It's a fraction of the ablation. And so that's where they would pick, fractionated pieces of the skin to ablate, which in effect would have less risk. But patients still had, a 2 to 5 day downtime, depending on how aggressive you went. And the results were just not really as high. So then we move on to today, where we have Vivace RF microneedling. And this is typically what you would look like after treatment, maybe a little bit pink, and you have no downtime, or maybe 12 to 48 hours of downtime where you're not wearing makeup, because we have some open channels. But the results are really high, given in a series of 3 treatments. You can do these treatments all summer long. You don't have to worry about sun sensitivity like you would with a fractionated laser or an ablative CO2. And you have, maybe you're pink that day, and you can go about resuming your normal activities. So we call this procedure a no social downtime procedure. So why are people so excited about Vivace radio frequency? 70% of today's patients are bothered by lines, wrinkles, skin texture, and or discoloration, which is some of the outcomes of our device. When asked, people are interested in a non-surgical treatment with less recovery time or no social downtime. And the American Society of Plastic Surgeons says that non-invasive treatments are outpacing invasive treatments 6 to 1. So when you look at the unique features of Vivace radio frequency microneedling, what we're doing is we're combining microneedling, which I'm sure many of you have heard of, which microneedling is collagen induction therapy. So we're actually popping holes in the skin, a little micro trauma to the skin to stimulate your collagen. You're basically, your body feels like it needs repair. And unfortunately, as we age, our collagen goes from, if you look at our collagen as a child under a microscope, it looks like a brand new rubber band. And if you look at our collagen as we age, even above the age of 30, our collagen is looking like a rubber band that's been sitting out in the sun and is very brittle almost. So it's a really big difference. So we're trying to stimulate your collagen with this treatment. And with regular microneedling, it is actually, the formal name for it is collagen induction therapy. And then when you add radio frequency, you add a long-standing treatment that tightens and also produces more collagen benefit when given in a radiofrequency microneedling mechanism such as Vivace. So we have depths from 0.5 all the way to 3.5. So we can deliver the energy in a customized way to your needs and your desired outcomes. So if somebody has a deep fold, we're going to deliver the energy deeper. If somebody has more topical superficial issues, we're going to deliver the energy more superficially. So also another unique feature about our device is that we have coated needles. So there are a lot of RF microneedling devices on the market, but Sanova chose Vivace RF microneedling because of its delivery system and the fact that patients can be comfortable during treatments and they have that no social downtime. So we have 31 precise robotic depth adjustments. Like I said before, we can go from 0.5 to 3.5, making it very customizable to you. We have coated needles. So when we're heating your skin up under, in your dermal layer, we're not causing any damage. So the needle goes in and out, sort of like a Botox style needle. It's a very gentle approach. So this is a little graphical image showing how the needles go in and out. And then we deliver that energy at the very tip of the needle. So, we with the Vivace experience, you will have some topical numbing before your treatment, and we will include some aftercare for you so that you are using the most gentle aftercare that will also increase the outcome of your treatment. And this is kind of what we'll put on. We'll put on a little sheet mask that will take some of the redness out of your skin and add hydration to your skin. And then we'll send you home with a serum that you'll use for the next 48 hours to 72 hours, discontinuing your usual skincare. And so, what really differentiates Vivace, it's really the most revolutionary, best in class RF microneedling device. We have won best of real self. Um, I think 3 years running. We also are in the aesthetic guide as a top treatment. Most recently, New Beauty featured us as the best RF microneedling device on the market. So, consumers are reporting it on Real Self as being a top treatment that they're, able to get fabulous with results with, as well as other news outlets. And really, it's because of that precision robotic motor. So radio frequency is important because it provides heat. So basically what we're doing with RF microneedling is I like to compare it to aerating a lawn. So we're aerating the lawn with the microneedling and then we're providing the fertilizer with the radio frequency heat. And radio frequency has long-standing principles to stimulate collagen production, which is proven to lead to tighter, younger looking skin. And so many patients report their skin textures improve, their tone. We can work on acne scarring, fine lines, deep lines, and it's just a really refreshed, more beautiful version of yourself. You look naturally you, but you do see a big difference with the series of 3 treatments. And there's no downtime. So we do have studies that back up this device. It is FDA cleared. Dr. Lane carefully looked at these studies when he chose to bring this device aboard. This displays the histology from the studies. So now I'm going to get into some before and afters. Hold on, I'm going to move through a couple of these because okay, so here's one that is showing the crow's feet. This is a picture by dermatologist Emil Tengetti. This is what you look like immediately post-treatment and 6 to 8 hours post-treatment and the next day. This is commonly how patients will look following their Vivace treatment. So that's pretty typical to what I look like. It depends really on how reactive your skin is. Some patients might be a little bit more tomato red than this patient, but typically for me, this is kind of a good example what I look like after treatment. So this patient has large pores, redness, and textural issues. I like to point out, when I first showed you that patient that had the CO2 all over her face and the loss of melanin, if you look at this lady's upper lip, she has had CO2 done, and that's why she has that white kind of loss of melanin look. So, that doesn't happen, all the time. It's more with kind of some of the old school CO2s, but that's kind of a description of what I was referring to. So this is large pores, redness, and textural issues. Again, that side view of her, you can really see such an improvement. Her skin, the tone, the texture, the redness, she got improvement on pigment as well. This treats pigment, but it treats it from a different level than, like, let's say, like an IPL or a BBL. This is really treating your pigment from the inside out. It's causing some cell turnover, which can reduce some dermal pigment. And you'll see that through the pictures. So this patient had a wrinkle and rosacea improvement with Vivace. This patient had some severe wrinkles that they worked on. These are all series of 3 treatments. You space this series of 3 treatments 4 to 6 weeks apart. So the neck, like typically when patients are getting this treatment, they're wanting to get the face and neck because it just is very uniform and we get beautiful neck results. Again, rosacea and wrinkle improvement here. So many patients with rosacea are left out of treatments, so it's really impressive that we can treat rosacea. Here's a patient with some hyperpigmentation. So this is not per se like a melasma treatment per se. And the question that would be asked is how does your melasma activate? So if somebody has melasma, I have melasma, but I got it after having my 2 children and then from birth control. So I got a very big reduction in my melasma with this treatment. But if you're somebody that is just like you can go work out and your melasma flares up, this isn't really going to be a treatment for you because it's just going to be a little bit too hot. But if your melasma is kind of more hormonal based, which all melasma is technically hormonal based, um, that's something. Okay, I have a question. Okay. We need to we'll talk about that patient. We'll talk to that patient after the call. Um, Here is acne and rosacea. Um, this patient had some textural issues right here. We do really great on textural issues. And here's acne before and after. So this patient had some active acne, which is something that you can talk to the providers about. And she also had some pretty intense scarring here, acne scarring. Because of the different depths of the device, we can really do a great job with scarring. Again, acne scarring, acne, acne. And these are all pictures from our physicians. These are not all internal pictures. These are pictures of our physicians' results. So I love this slide deck because you can really see what offices like Dr. Lane's office are doing with this device. This patient just had some slight textural issues and just got beautiful results. This patient actually had 4 treatments. So if it's not 3, we wrote it on the side. So this patient had 4 treatments 1 month apart. But generally speaking, most patients, it's a 3 treatment protocol. This patient had 3 treatments, 2 at 3 weeks, and the third treatment at 2 weeks apart. It's normally suggested we do 4 to 6 weeks, but if you have, an urgency, like you're traveling this summer and you need to get it in a little bit earlier, we do have patients that do very well with that. You can see he had a lot of textural improvement and pigmentation improvement. And skin thickening. We don't thin the skin with this device. It's very safe. We have not one adverse event in all of our in all of our 3 years on the market. We don't have one long-term adverse event. So that's really exciting. It's a very safe procedure. Here's another patient with some ice pick scarring. And this patient only had 2 treatments 4 weeks apart, but beautiful results with him. And then we have crow's feet here. You can see her crow's feet are minimized greatly. And again, crow's feet. So a couple things to note with radio frequency. When you're doing this series of treatments, you're going to see the immediate improvement on tone and texture. Right away from the microneedling alone. But the radio frequency takes a full 12 weeks to kick in. So really when you have completed it depends on when you spread out your treatments, but it might not be till the third treatment till you get the full RF results. And then on your last treatment, it's 12 weeks after that for full results. And then I always call it the gift that keeps on giving, because after your last treatment, you will then continue to see results 8 to 12 months after your last treatment. So it really is the gift that keeps on giving. So what I'll typically hear with patients is maybe before their third treatment, they'll be like, oh my gosh, I was out to lunch with my friends and they said they noticed something different about me. This happened to my mom. My mom said that her friends were like, something's different. And did you get filler or Botox, or what are you doing? Your skin looks so great. And she was like, they weren't that great of friends. So I just kind of kept it a secret of what I was doing. I was like, no, you need to tell everybody. You need to be the walking marketing tool for me. So it's funny because different patients will pop at different times, but your full results will be 12 weeks after your third treatment. So just keep that in mind. But most people say they have like an immediate glow and textural improvement right away after their treatment, it's really nice. You do see some beautiful results right away. We actually do have an amazing special, but first I wanted to open it up to questions. What questions do you all have? If you want to press the unmute button.
I have a question in regards to if you've had filler in a certain area, but then you have textural issues where that filler is put, the surface of your skin. Can that be done over the filler that you've had put there, or how does that work?
Yeah, so it can be done after your filler has been put in. We typically like it to be, somewhere between 2 to 4 weeks after your filler, so your filler can settle a little bit. And
Okay.
then, yes, you can do it after your filler.
Wonderful. Thank you.
I have a question. How does it work with scarring? I had surgery on my neck, and so I have a scar on my neck. How would you handle that?
Yeah, so that would be something you can show Kaitlin like more specifically. I think she is going to call y'all all after the call for those that are wanting to chat, and then she could probably evaluate that scar. We do great with scarring. I know there was a lot of pictures of acne scarring, but we do wonderful with scars. But that would be something I'd like Kaitlin to kind of evaluate your particular scar and wants and desires.
Okay, thank you.
And Kaitlin is really great about setting proper expectations of the device and taking a look at your particular needs and letting you know exactly what you can expect, and if you're a correct patient for the device. We do treat all skin types. So generally speaking, I always say, really is for everyone. It's for somebody younger that's wanting to maintain. It's for somebody that has a lot of corrective issues. It really is like I said, it's like aerating the lawn and putting the fertilizer in. Any other questions today? Y'all are a quiet crew. Can a provider go too deep and cause? I have another question. Can a provider go too deep and cause fat loss? So apoptosis of the fat takes a full 8 minutes to really heat up the area at a certain temperature. So this is not a fat loss treatment. You cannot lose fat. There's some older devices that were rumored to have that issue, but we are putting the perfect amount of heat in, and we will not be causing any fat loss. Kaitlin, how has the treatment been going in the office?
Yeah, it's been going really well. Jennifer has been treated and she did really well with the treatment. And we've kind of just been telling everybody about it because I think, like you said, there's not really a patient that it won't, have a purpose for. So I think it's been going great, but I mean, we can, we can see a purpose for it for everybody. So I think it's been going really well so far.
Great. Okay. Well, so I believe what the front desk is ready for you all to call and book your treatment. Taylor, is there anything you wanted to add? I believe they're going to let you put down a deposit in order to secure the special, and then you can pay the rest at your first appointment.
Correct. And this is Taylor with Sonova Dermatology. I'm kind of lurking on the side. Yes, as Ashley said, she was perfectly spot on. You are welcome to pay a $100 deposit when you call. If you're very interested and want to make sure you secure the deal and don't want to forget about it, you're welcome to call us right after the event. We will be in the office until 5 p.m. We will be having Kaitlin reach out to you guys, everyone who joined us today, tomorrow, just to answer any questions that you guys may have and assist you if you wanted to get scheduled. So if you don't have time today, we will be reaching out to you guys tomorrow. And I think this is a fantastic deal for this. This is going to be the lowest we're going to offer this, which is super exciting for you guys because basically you get to like latch on before it gets hot. So we're super excited about that. So yeah, just really excited about this promotion, and thank you, Ashley and Kaitlin, so much for sharing all this, all these before and afters, and telling us about this like innovative technology. It's so exciting to have this.
Yes, we're excited, and we're excited to be in Dr. Lane's office. So Kaitlin will be calling you all if you have any further questions, as Taylor said. And then if you are confident and ready to book, you can go ahead and call the office. Okay. And Kaitlin or Taylor, could you give that office number?
Yeah, our office number, it's we're here in Steiner, and it's 512-266-0007.
Okay, everyone. Thank you so much for joining today. I appreciate you taking the time to learn more about Vivace.
Thank you.
Thanks.
Bye.
Bye, everyone.
Thank you.